morning, I'm Louis Bass, CEO of RMC Health System.
Good morning, I'm Joe Weaver, CEO at Stringfellow Memorial Hospital.
We've come together today to try to give everyone an update on the transition process of the Stringfellow campus. We're going to provide for you today information that we have been providing to our staff over the last several months, making sure that they were aware of where we were going and how we plan to execute on this transition process.
As Louis mentioned, we have started this process. It began several weeks ago. We started by transferring our medical detoxification unit and our intensive care unit from Stringfellow to the main hospital. That transition was relatively seamless, and we're in the process now of beginning the next phase of that, which will begin on or about July 18th, where we will be shutting down our emergency room operations as well as temporarily suspending our inpatient operations at Stringfellow Memorial Hospital. We do have plans for an outside company to come in and operate the space that was formerly used as our emergency room department. They will be opening up an urgent care center there. That center will not be affiliated with RMC, but we do certainly expect to maintain some type of professional relationship with them from a patient referral standpoint. So we're very excited about that. As with any type of transition of this sort, there's obviously going to be a lot of fear, anxiety, and to a certain extent some anger as well, and that's certainly to be expected. We have a lot of employees at Stringfellow who have been there for many years. A lot of those employees see that as a second home, so obviously there's going to be some anxiety, but we're doing everything that we can to quell that fear and anxiety. There are two things that we have to be cognizant of here. One, we have to make sure that we preserve health care in the city of Anniston and the 5 counties that we serve. There's some 250,000 people in our communities who rely on this hospital, and we have to do what we feel is in the best interest of the community. Our hospital's economic impact on this community is just north of $500 million. And it's very important to us that we preserve that. But at the same time, we want to make sure that we also preserve the integrity of the staff and the plans that we're making for them as well. That transition process is going pretty well. We certainly expect to have it completed sometime by the end of July, and at that point in time, we think that things will get back to normal, and it should be business as usual for our hospital and for the community. We certainly hope that the community will look at this as being positive and understand that, again, what we're doing here, we feel is in the very best interest of the community that we're serving.
I think one of the primary issues that we've dealt with over the years is the splitting of our staff and trying to operate 2 acute care facilities that are 9 blocks apart. It's very difficult, it's very expensive, and especially in today's healthcare environment with reduced reimbursements from the governmental payers, the shift to Medicare Advantage programs, cyber attacks that have hit in the industry recently, and then coming out of the pandemic, and the workforce issues that hospitals especially are facing as a result of the pandemic. So we've made this decision, we're moving forward. We have made some significant changes on the RMC campus in order to be ready for this transition. In particular, within our emergency room, we've created some vertical zones. We've created as we transition, we will be able to run a 24-hour-a-day fast track unit, which will allow us to address low acuity patients who come in, especially after hours. One of the benefits is that we will be able to transition the emergency room physician staff that's at Stringfellow today down to RMC, and that will allow us to provide additional physician coverage during peak hours throughout the day. We believe that will be a big benefit to us. But our staff is working very hard. We have integrated the staff from the Stringfellow campus. We anticipate keeping the vast majority of those employees within the RMC health system And actually, as Joe said, we have already moved quite a few of those employees to this campus. So unfortunately, it's healthcare today. You saw it with the announcement of Ascension selling their properties and their hospitals to UAB Health System. If you read the papers, if you follow it, you'll note that Alabama, Joe has these numbers a little better than I do, but in the state of Alabama, in excess of 50% of the hospitals, especially, or the majority of rural hospitals in Alabama are under financial distress. And so it's very important for us, in order to continue to serve this community in the manner that which the community deserves, that we make the best use of our financial resources. And in doing this, coming together, we believe this is the thing to do. It will allow us to continue to utilize Stringfellow for something that they do extremely well, and that is to utilize their surgical services, their gastroenterology services, but also to provide some additional services there, maintain some ambulatory care services that will help to provide an additional location and maintain that location for us going forward. The urgent care center that Joe mentioned, our anticipation there is that that's going to run 7 days a week. And it's going to be provided by a very reputable organization that will soon announce. And I think that's going to help tremendously in growing and providing an additional outlet for someone to come and have care.
From a consolidation standpoint, I think that one of the other advantages that we're hoping to see is that when patients come into the hospital for testing from time to time, because we're having to split staff across both campuses, you can't always get in to have your testing done in a timely fashion. And I think that being able to bring these two staffs together will certainly give us an opportunity to be able to significantly eliminate those types of things. So as opposed to having someone from the scheduling department tell you that you can't come in to have your test performed for 3 weeks, we're hoping to significantly cut down the amount of time that it'll take for you to come in and be able to do that. I think that that's going to offer us some tremendous advantages. I know that that's something that's very, very frustrating, and oftentimes it may lead to folks in our community leaving the community to have testing done, and that's not something that we want. Our goal is to be able to treat 100% of the patients in this community who require health care, who have health care needs, whose time we know is very, very valuable. Lewis has already mentioned some of the things that we're working on in the emergency room, and I'm happy to say that I can already see some of those things starting to happen. It's not going to occur overnight, but I can assure you, or we can assure you, that we're working diligently on that, and as we make significant progress, we're going to do everything that we can to make the community aware of that, and certainly ask you guys to make sure that you think of RMC first whenever you have a healthcare need, as opposed to thinking that this is just going to be another one of those situations where I'm going to have to go there and wait and wait and wait. We're working diligently on that. We have good staff, and I think that, as Lewis mentioned, bringing the staff to the emergency room from Stringfellow, as well as bringing some of the Stringfellow physicians here and doubling up on the physician presence in the emergency room is certainly going to help that, and we're really excited about those changes.
So are we going to have hiccups in this process? Absolutely. No transition comes without pain. No transition comes without hiccups. But what Joe and I and our team will guarantee you, and our physicians, is that we're going to do everything in our power to make this as seamless as possible. Can I guarantee you that you'll never wait in our emergency room for a bed? No, I can't. But I can guarantee you that we're doing everything within our power to make sure that patients are taken care of quickly, taken care of properly, and that they receive, as Joe said, the kind of care that I would want given to myself or my family, the kind that Joe would want given to himself or his family. And RMC is committed to Calhoun County and our region. We've been here a long, long time. far longer than Joe and I have been on this earth, and RMC will be here to serve you going forward for a long time. And we believe this transition is going to be a positive step forward for the organization, and we're very excited about it, very excited about moving forward.